Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Ted Whitten is a passionate clinical sonographer with a career spanning more than 30 years and most recently has worked as an ultrasound practitioner at the Elliott Hospital in Manchester, New Hampshire for the past 17 years. After receiving his bachelor's degree in biology from Cedarville University in Cedarville, Ohio, he went on to attend the sonography program at New Hampshire Technical Institute in Concord, New Hampshire. Soon after graduation, Ted was involved with helping to start a local sonography society in New Hampshire and continues to be involved locally, nationally, and internationally in educating sonographers and promoting sonography. Ted firmly believes that the most important factors in enriching your career and helping you become a local sonographer expects a local sonography expert are staying connected with sonography students and education, volunteering for local and national sonography societies, credentialing organizations, and of course, the SDMS. Don't be afraid of getting involved outside of your comfort zone. As he likes to say, learn new things, do new things, teach new things. Ted's passion for sonography led him to help start a local sonography society in New Hampshire and eventually serve as its president. He also is very involved with the New Hampshire Board of Medical Imaging and Radiation Therapy and has served as the sonographer board member for the last 8 years. As a passionate volunteer, he has served and continues to serve in various roles for the American Registry of Diagnostic Medical Sonographers. Ted has also served in many roles for the SDMS, including serving as president of the SDMS and SDMS Foundation. Please help me welcome Ted Whitten. Thank you, Ted, for coming to the podcast to talk about advanced practice sonography. I'm thrilled that you're here. I have watched you from afar on many webinars and seminars and different things. You make me proud to be a part of this career because you've given so much and you have such a passion for it that it has really inspired me to kind of give back to my profession as well. And so you are a huge inspiration to me and one of the big reasons for starting something like this. So thank you. Thank you very
Well,
much.
thank you for what you do, because you're doing something that I would be terrified to do.
That's a little, you're pretty close to it. You're pretty close to
Yeah.
it, but we can do hard things and things that scare us. And so I'm hoping this will just give us a little bit of community and connection so that at the end, if someone hears you talk about this, then they'll have resources of places they can go and people they can talk to in order to maybe get more information and know what's going on the other side of the world in ultrasound, you know?
Right.
So that's our biggest goal. But first, I want to start just telling our audience, tell us a little bit about you. How did you get into ultrasound? How did you get started?
Oh boy. Uh,
Right?
I guess I need to to cut it short. I mean, I went to college first and I got my degree in biology pre-med. I was planning on going to medical school actually. My second year in college, I met my now wife. We got married the beginning of my senior year, which I guess added a lot more stress to college because all of a sudden I had to commute an hour each way to college to finish up my senior year. But
Oh, wow.
and then when I graduated, I applied to medical schools, a few of them. I got put on what they call the waiting list, the alternate list on two of them. I narrowed it down to one, put all my energy into that. And I said, what do I have to do to get in? They told me I did it. I did very well in school, so I was confused why I didn't get in anyway. And what it came down to, I know it would be different now, but the reason I did not get into medical school was because I was married.
Oh,
Yeah,
interesting.
which kind of shocked me because I thought it would be an advantage, have my wife
Yeah.
helping me. But they said no, medical school is very stressful, and either you get divorced or you drop out of medical school. And frankly, we don't care if you get divorced. But if you drop out of medical school, that's a huge financial hole for us that it's very difficult to fill. I said, well, I'm
How
not
many
getting
years ago was that?
uh, a lot. Over 40.
Wow. Okay.
Yeah. And it's different
So
now.
you don't
Back
hear about
then,
that kind of thing anymore, do you?
no, they wouldn't be able to get away with it now, I
Right,
guess.
right.
I was discouraged, so I kind of floundered for a couple of years. It was my wife actually that made some calls because she knew I wanted to be in healthcare. She contacted a local community college and just to see if I would go up and talk to people about different healthcare careers. Was not happy she went behind my back.
Okay.
Went to the appointment anyway, and it just everything seemed to be laid out perfectly for me. I ended up the first person I talked to was radiology. While I was talking to him, the director of the sonography program walked in. He goes, "Oh, this is Ted. I'd love to have him in radiology, but I think he should go right into sonography." She goes, "Well, actually, I'm just coming back from my office and somebody dropped. Our class has been full for like 9 months, but somebody just called and said they're dropping out. I have one opening, but you need to tell me right now if you're interested." I said, "I can't go home and talk to my wife. No, I need to know like right now."
Oh,
I
wow.
said, I'll do it. So I went back
Wow.
home. My wife said, "So how'd it go?" I said, "Well, good news and bad news." The good news is I'm going into the sonography program. The bad news is you're going to have to go get a job. She was a stay-at-home mom for two of
Okay.
our little kids. So,
Okay.
so anyway, that's how I got in. It's my wife's fault.
It's your wife's fault. Yes, as everything is, right? That's awesome.
Yeah,
Well, there was probably a divine plan there a little bit, right?
yeah, there
Don't you
is.
think? With I
I
don't think
definitely believe that.
not
Yeah,
everything is an accident, right?
right. No, it was not.
Awesome. Well, I'd like to just thank you for sharing that. I like to hear everyone's story as how they come in because we all come in so different sometimes, and there's no right or wrong answer of how you come in,
Mm,
as long as you're in and contributing. So that's awesome. So you shared in the STMS. So recently we've just returned from the STMS conference of 2024. And I have to say, I hadn't been to the STMS conference for about maybe 5 years. So I think I came at this in a really unique way as to see new and different avenues of things that I could learn. And I was just amazed at how many skilled people were there to assist you at any level that you're at,
mm,
right? So a lot of my mentors and some um, instructors, Charlotte Anderson, and then people that I could meet finally after reading some of their studies, Joy Guthrie and different ones like those. Um, a classmate, Joe Ryan Anderson. So different ones that were so faithful at giving back to me that I almost felt like I was there, like I owed it to them, you know, for giving so much to me. And so it was just a wonderful place. And when you greeted me, you took my hand so gently and just gave me your full undivided attention and directed me right to the person that I need to talk to. And it was just so supportive of an environment. And I think if you're really wanting to take your career to the next level, it's a great place to be to get connected with people who are so giving of their time and so willing to take our profession to the next level. And
Right.
so it was a wonderful experience, and I loved meeting the people there, and I'm excited about hopefully getting more involved as things go by. But you did share um, a talk on advanced practice sonography and where we're hoping to take our profession in the future and hopefully rather quickly, right?
Right.
And so we talked about the changes that are happening across sonography and how we could better improve them. So I just wanted to kind of walk through that talk that you had shared to share with our audience so that they have an idea of what SDMS does, that they've been around a long time, they've been talking about this for a long time, and there's definitely been some progress and some places that we can go now to advance our practice. So on your talk, um, you just kind of started with the history of it. So how did it come about? Uh, yeah, let's start there.
So it started, I guess, officially the discussion about it in 1996 with the STMS, where they decided that, the ultrasound practitioner concept, that's what they called it at that time, um, was something important and something that we should pursue. Um, they had different task force, different committees over the next few years. I served on one of those, the Advanced Practice Committee. I even chaired it for a couple of years. Um, that was my passion, um, to follow that. Unfortunately, they got a fair amount of resistance initially from mostly physician groups. And I guess a big one at that point in time was the ACR. And I think some people in leadership for the ACR were afraid that, you know, that we would start billing for our services. And I think they were worried about losing financial turf. And because of that fear, um, they provided resistance. I think if they fully understood what it was, they would have embraced it because we were only there to help them, not to bill for our own services.
Mhm.
Billing has never been a part of it. So over the years, back and forth, resistance. It's the old chicken and the egg thing with advanced practice because what comes first? Do you have educational programs first, or do you have credentialing first? You
Mhm.
know, there were in probably the mid 2000s, late 2000, before 2010, there were some schools that were interested in providing the advanced practice educational program at that point in time as a master's level degree to equate with other advanced practice professions within healthcare. Um, but some schools were hesitant to offer a degree for something where there was no way to measure success because there were no credentialing exams that the graduates could take to see if they did a good job. Credentialing organizations were hesitant to create a credential because there were no educational programs for it. So we've been dealing with that over the few years, but it doesn't really, I mean, it does matter. We need to make it official, but that didn't slow down progress. Over the years, there are several thousand advanced practice sonographers across the country currently. Um,
Okay.
Even for the time that I've been involved promoting it at the SDMS, it has significantly become more popular. In fact, after the STMS, I had a couple sonographers reach out to me and said that my institution wants to do it. You know, can you give me any information? So I sent them all my information I had, job
Awesome.
templates, job descriptions, everything they needed. So, I mean, it's moving ahead regardless. But I think ultimately, in order to be officially recognized, um, there has to be formal education and a credentialing exam. I mean, I've been working as an advanced practice sonographer formally. My exact title where I work at the Elliott Hospital in Manchester, New Hampshire is Advanced Ultrasound Practitioner. That's my title. But if I were to move to another facility, it probably would be a different title. It's just
Right.
there's nothing the same. So I think it needs to be standardized. It took me many years of personal mentoring from physicians and other, senior experienced sonographers putting energy into me. I don't think we can wait that long anymore. I think we need to, abbreviate it. Formal education is definitely the way to go. And I'm continuing to promote that.
That's awesome. That's awesome. Yeah, so they dropped it. STMS kind of dropped it for a while, but then they picked it back up. Would you say like 2014, something like that?
Well, it was around that time that I was chair of the Advanced Practice Committee. Shortly after that, I went to serve on the board. They never really dropped it. It just was in a holding pattern because
Okay.
I think they were trying to figure out what direction to go. We were getting resistance in this direction, so maybe we should target this direction. So, yes, people didn't hear about it. It wasn't in the news, but it was still a thing that the SDMS was promoting.
But today we do have practice guidelines then that include advanced practice
Well, we
sonography.
do in cardiology. That's
Okay,
the only current one we have now, the advanced cardiac sonographer.
correct.
Um, we have two formal educational programs in the country,
Okay.
and there is a credentialing exam through CCI. There's works on, I don't know if it'll be termed advanced practice, but it will be similar to advanced practice in perinatal sonography,
Awesome.
that the ARDMS is currently working on a project. So I think that would be a good thing too. I have some friends that are MFM sonographers and they have official advanced practice positions where they work. So,
Awesome. So, the definition you gave as an advanced sonography is an advanced sonographer and a mid-level provider as part of an interdisciplinary team. The advanced sonographer provides advanced level sonography services based on clinical competency obtained through advanced education and clinical experience. The advanced sonographer works under the authority of her supervising physician. And note that the advanced sonographer has also been referred to as an ultrasound practitioner, an advanced practice sonographer, and a clinical sonography specialist.
and many more,
And right,
and
right.
many more. Yeah. So it is a
So it's an
mid-level.
evolving, it's still evolving, right?
Yes.
So tell us about your mentorship then with Steve McLaughlin.
I first met Steve McLaughlin when I was president. I helped start a local sonography society in New Hampshire and was initially the vice president. I went on to serve as president. And while I was president, I asked Steve to come and speak to us. And that's when I met him personally. I had read about him, in
Mhm.
journals, but I had never met him before. And his personality was contagious. I mean, his enthusiasm was awesome. And I think that's what made me get addicted to reaching out and serving the sonography community beyond, my 9 to 5 job, you
Okay.
know, local societies, national societies, credentialing exams and stuff like that. So he definitely, I said it during the lecture that he set me on fire, and that basically he did.
Yeah.
He did that to many people, but he did it to me personally.
So then you really kind of took it upon yourself and took the initiative to really kind of speak to the chief radiologist and director of radiology about providing more of a role of advanced practice. Is that correct?
Um, well, yeah, that part's interesting because where I was working as a supervisor at the time, I talked to them about that and they said, no, I don't think we're going to really do that right now. But I had given a lecture at an annual meeting at our local society on advanced practice, and one of the attendees, who is a supervisor at a competing hospital, was there in attendance. And unknown to me, they were trying to create an advanced practice position. So she reached out to me and I said, that lecture you gave about advanced practice, I think we're going to do it at our hospital. Are you interested? I said, absolutely, I'm interested. So I
Okay.
think they wanted to do it, but they didn't really know what it was.
Yeah.
So he had all the information I provided to them. Had a nice conversation. I never had a formal interview. I met him, the chief radiologist, at lunch, and then I met briefly with the director of radiology. Basically, told him what my definition of advanced practice was. Then the next thing I knew, I was offered the job. So yeah. And then
Awesome.
when I gave notice, my facility where I was a supervisor said, well, we can do that
We can
too.
do that
And I said, no,
too.
sorry.
A little too late.
Had your,
A little
yeah,
too late.
yeah,
So then discuss maybe some of your roles now,
yeah,
of things that maybe you do. Like I know,
right,
right? Every advanced practice practitioner is a little bit different, just
right.
depending on their
So,
specialty, right?
so
And
for me, my role um, is very similar to, an early in my career, radiologist that was really enthusiastic about learning sonography. They loved sonography. It was new, something different, with real time. They were fascinated by it. And we worked very closely with the physician. A lot of questions back and forth on difficult cases. Um, that rarely is available to sonographers now. Unless you're in a teaching hospital or something like that, where you may have it. Most hospitals don't.
right,
They don't have radiologists that are passionate about sonography. So basically, my position fills the void that was left by that radiologist years ago who
right,
did my mentoring. So
right,
so I help fill the gap for them. I help them with their workload so they can read cases a lot faster, maybe more accurately. Um, I help the sonographers. It's easier to come to me with questions instead of going to a radiologist that's sitting in a dark room someplace reading PET scans or MRIs or something.
right.
Filling the void, I think that's my role.
Okay, so does that include any like supervisory responsibilities at all, or is
I,
that
uh,
separate?
Yeah, that's a great question, and that differs too throughout for facilities. But because I had been a supervisor already for 16 years prior to getting into this position, I did not want to be the person that got a call at 3 o'clock in the morning from a sonographer saying I'm sick, I can't work, and then trying to find somebody to fill it. I said, I don't want to be in
Right.
charge of staff anymore. I want to
Which
be
is why I've
100%.
never wanted to be middle management, right? Like
Yeah,
that kind of a call and trying to fill out a schedule. I think is a living nightmare, right? Like,
Yeah, it is. It's awful.
I mean,
People,
I hats off to the managers who do it, but those are two huge reasons why I just didn't want
yeah,
middle management, you know?
yeah. I enjoyed it while I did it, but I had enough. I wanted to be 100% clinical. And so I am
Awesome.
100% clinical. So I provide some leadership to the supervisor, but he's not under me. I don't have any employees. I
Okay.
just work directly between the radiologists and sonographers. So
Awesome. Awesome. So do you do your own, do you sign off on reports at all?
no, I mean, this, I mean, do this is the question that everybody asks, right? Do
Right,
sonographers
right,
diagnose? It
right,
depends
right.
who you ask, because the legal definition of diagnose um, says only a medical provider can diagnose, and that is a legal signature that only they can give. But sonographers every day
Diagnose.
diagnose because, is that a gallstone? Maybe I'll turn the patient up to see if it
Right,
moves.
right.
We constantly diagnose, but the official legal diagnosis only comes through a physician. So
Yeah.
I just make sure that the radiologists have all the information they need to make the right diagnosis. And if
Okay.
they initially misdiagnose something, then I help guide them into the right diagnosis. So,
Okay.
so I
Okay.
also ask them to do addendums if they get things wrong. So,
Okay.
which is
Okay.
not that often because usually
Right.
they listen to us the first time, but
Right.
occasionally it does.
So then are you a part of any kind of research? Do you do research at all?
I would love to do research, but no, I do not
Okay.
formally. I'm jealous of my professional colleagues that work throughout the country that do research. I would love to do it, but
Okay.
we don't really do much research where I am. So I do
Awesome.
not.
So you mentioned Mickey Clements in your
Yes.
and so
University of Alabama, Birmingham. He's
okay.
been an advanced practice sonographer. They call them sonographer radiologist assistants where they are.
Okay.
Um, the radiologist that oversees the ultrasound department, Dr. Michelle Robin, is world renowned expert radiologist in ultrasound, and she works there. And they have 5 full-time SRAs and then 2 kind of part-time flex ones. So
Wow.
it's one
So
of
it's a
the
big
epicenters
department.
of advanced practice. Yeah,
And where
they
is
have a
that?
great one. University of Alabama, Birmingham campus. It's at the medical center. UAB.
UAB. Good
Yep.
deal. And then so that's general radiology, right? And
Yep.
then Tony
Similar to my
Horton.
position, really.
Okay.
Their position is very similar to mine.
And then Tony Hurton
Yeah,
is
she's
in
an MFM
MFM.
sonographer at Mass General in Boston, so she's not very far from me. Um, and she's been working there in an advanced practice role for quite some time, and she's actively involved in this project now with the AIR DMS, researching the feasibility of creating something for perinatal sonographers, MFM sonographers. So,
Awesome. And so her roles are a little bit different in the fact that she obtains additional imaging, I'm sure, if we can't get an image or something because of the baby's position, but she back scans all of the details. So I think
right.
that's interesting. Having two people scan a detailed anatomy is wonderful. I mean, I guess some people would say, well, I do a good enough job. I wouldn't need someone to back scan, but I always think 4 eyes are better than two, right? And how many times have I walked outside of a room and said, I just can't get this? And somebody walk in and boom, there it is, right? Baby rolled
I
over or
Yeah,
something.
I think the best sonographers, frankly, are the ones that have the mindset of, I do not know everything.
Right.
So if I can
Exactly.
watch somebody else scan or do something, even if they're less experienced than I am, they may do one little thing that I think, hmm, that's interesting. I think I'm going to add that to the way I do it.
Right.
So I think it's a great thing too. So,
Yeah. Yeah. It's a community of learning. She also,
yes.
some of her roles are educating residents and fellows and sonography students. And so she functions as a mid-level provider,
Yeah.
sonographer practice at Mass General. So
Yes.
that's exciting. So then you talked about Cherish Hockey,
Yeah.
and she's another MFM, right? And she's
Yes.
100% remote work.
Yeah,
So,
that fascinated me. And I
right?
I did not know about her until I actually heard about a webinar that the SDMS did and she presented. And it's like, what? 100% remote? That fascinated me. So yes,
That
she
is
does.
fascinating. So I might have to get a hold of her and, and have her come and talk. That would
Just,
be um exciting to see how they do that. So
yeah.
um
I mean,
it's
there's a lot of facilities that don't have the expertise of MFM sonographers or even an MFM physician, but they want to offer high level sonography. Maybe it's a rural place. Somebody's going to drive 2 hours to get someplace.
right,
But if she can work with them remotely and mentor them and oversee their work, I mean,
right.
that really helps patients that live in those remote areas. So,
Yeah, and I liked well, she's responsible for billing, and she also was responsible for cataloging significant pathology,
yeah,
which I think is a super bonus to any program or any
yeah.
place that you go, right? Um
And that's something that I do too. I have a running
okay,
catalog. So every time we do a case that has interesting pathology, or maybe it's something that we have no idea what it is, I track it. So if they ever come back for an MRI or a CAT scan or even surgery, then I get all those reports and I correlate them to the ultrasound findings. And then I go over it with the sonographers and I go over it with the radiologists involved. So I think they thrive on that too. The radiologists love it.
yeah,
Seems like the only time they ever hear
right.
feedback is negative feedback. So to hear, positive things, most
Right,
of radiologists want to learn too. So yeah,
right,
they love it.
right. So those are really good um filling in where things are left out, right? Like
Right.
you had mentioned earlier, just what a, I learned by my mentor saying, okay, here's this case, and looking at it, and here's this case, and this is what we saw, and this is what I took, and, so different things like that. And then, of course, our ever lovely Joy Guthrie, who's just a joy to meet and a beautiful soul. And she is a PhD, so she has an interesting program too, if you want to share about that.
Yeah. I mean, she is a PhD, so research is a huge part of what she does, not just in sonography, but at her facility. She's responsible for overseeing other research too, just because she can do that with a PhD with her
Sure,
education. Um, she also is one of the two programs that has the advanced cardiac sonography. In fact, she was the very first one that offered it. And recently, there was an article in the SDMS that came out that she tried two new programs, one in perinatal sonography and one in vascular sonography for mid-level providers. So it's going to be an advanced practice sonographer position, and she just went ahead and started it to see, I guess, where it goes, because she's
yeah,
a brave soul, that's for sure.
yes, she is.
She's a
But
giving person.
she's amazing. And so what and generation to be a part of, to know people like you and Joy and
Mm.
different people who give back so much, Charlotte Anderson and Doug Clemens and different ones that and then I can't think of the other lady I met, but she I think works in um pediatrics, and she's done a ton of research and
Was it Tara Sielma?
I think it might be, yeah.
I mean, there's a few of them that were there, but she was in the pediatric. I mean, she was in the general abdominal track the whole time. She was in charge of that. But yeah, she works at Nationwide Children's in Washington, D.C. And
Yes.
she does a lot of research.
Yeah, I think so. Yeah, so I guess our takeaway, as we've talked about it, is how important formal education is and credentialing, and that we are getting to where I didn't know there was over 1,000 advanced practice sonographers.
Yeah,
I thought there was a lot less of a number, but I'm glad to see it's in a much more um higher demand now. So I'm happy about that, and just creating those partnerships, um, I think is good. And you went over the benefits to the physicians, right, for the advanced
right.
sonography. So can you share with us your takeaways
I
on
mean,
that?
some of it I covered already just by giving them a feedback on interesting or confusing cases that they were involved with. I also provide education for them for some of the new procedures that we do. Plus, I let them spend a lot more time in their dark reading rooms so they can read a lot more cases, which fits the business model better. You know, if the
Right,
more
right.
cases they read, the better. So the less interruptions, the better. And that's where advanced practice sonographers, we can deflect a lot of that because we handle it ourselves.
Right. And then the benefits to the ultrasound techs, they have assistance with difficult cases and teaching and mentoring, which
Yeah,
I think we've kind of gotten away from a little bit,
yeah. I
so I'm excited about that.
That's, yeah, I think
And
that's easy. You know, we hear it constantly from sonographers. They're getting burned out because where they do sonography is turned into like a factory, and you just get them in, get them out, get them in, get them out. And
right,
that's all they care about, and nobody's investing time with the sonographers to teach them. Sonographers are sonographers because they're kind of like Sherlock Holmes. They want to figure
right,
things out. They don't
right,
want to just push buttons on a computer.
right,
That's the way they're geared. And
right,
when we go in, with difficult cases, if say it's an appendix or something and they say, I can't find it, well, then I always go in, I scan, they watch me scan, they learn some helpful techniques to help them improve. So they
right,
constantly learning, it's I'm trying to imitate the mentoring that I received from physicians early in
right.
my career. I'm providing that to sonographers. So
Yeah. Well, and just ways to, um I think research is going to be a big part for ultrasound, and if sonographers can start learning how to do more research and really kind of carve out their niche, right? Like you talk to some other people who lectured, and they've really carved out like a niche of Epstein's anomaly, or diabetes and pregnancy,
mm,
or TCD, right? In the head, which is a nemesis. But yeah, I mean, then you become kind of an expert on something, and then you
yeah,
share it with the community, right? And
yeah.
so I think that's going to be super huge and important as we kind of move forward, I think, with it.
I
Um,
always tell sonographers never be afraid to do something or be the first one to do something. You know, be curious, be willing to step outside your comfort zone and try something, because that's where you really learn. And I think that's where all the joy comes, not from doing the same thing every day, but doing something else, that nobody else has done. And you start behaving that way at work, and people are going to be looking to you for leadership. So if a position opens up for advanced practice, guess what? They're probably going to ask you first, if you're that one that everybody looks up to. So be willing to step outside your comfort zone and try something.
yeah, it's amazing. I talked to another young lady, Christina Worth, a couple weeks ago for a podcast, and she shared a technique with me about finding the uvula for cleft palates and how she researched that. And I thought, man, why didn't I figure that out? I knew about that. Um, but she took the time to research it, and really kind of make a presentation about it. And so now she's kind of mentoring others, and then she's sharing it with um the sonography community through her Echo Mentor uh,
Mm,
a website. So I think we're gonna explode for hopefully mentors and
yeah.
people
The
to
future is bright for sonography, that's for sure.
I think so too. And I liked what you said that everyone's a teacher, you know.
Even the
Um,
ones that don't want to be a teacher are a teacher.
right. You learn what you don't want to do. I
Yeah,
always tell my well, I try to remember to tell my students, ultrasound students that I teach, take what you like and leave the rest.
yeah,
Like you're gonna meet somebody else and do something a little different, and then just work it out to, shimmy it up to what you like to do,
right.
and what gives you the best results. So, you also shared a quote from Socrates at the end. Smart people learn from everything and everyone. Average people learn from their experiences, and stupid people already have all the answers.
Yeah.
And I love that quote. I think I need to hang that up in a few places. Well, thank you again for your time. And the one question that I like to ask all my guests at the end is, our podcast is called It's All About the Frequency. And we know we see more detail and more beautiful things at higher frequencies. So, what do you do in your life to vibrate at a high frequency? Like when you get down at a low frequency, what are some of the things you do personally to kind of, bring your frequency up to a higher level?
Okay. So for me, in the work environment, I am attracted towards students because they are the ones that are eager to learn. They're the ones that don't have the bad attitudes. They have positive attitudes. So whenever I start feeling burned out or exhausted at work, I just like to hang around students. They have a positive attitude. And I
Yeah,
keep telling them, don't let, the old fogey sonographers that have been here forever throw buckets of water on your fire.
yeah,
Don't listen to them.
good.
So I love
So what do you
students.
do personally then?
Ugh.
Do you have any other
I,
hobbies other than ultrasound?
to be honest with you, not a whole lot. I mean, I have a wonderful wife. My youngest sons, I have 5 kids.
Oh, wow.
Um,
Okay.
I still have one living at home. He's 24. He has Down syndrome. And
Okay.
I'm actually the one who diagnoses cardiac disorder. After a high risk ultrasound said his heart was normal, I was watching. I said, I don't think so. So I asked the doctor to order another one, and I wanted to scan it myself, and I found out he had an AV canal defect. But people with Down syndrome, Well, especially my son, he's always happy. I mean, I literally get, I don't know, 8 or 10 hugs every single day. How many
Yeah.
24-year-old kids do that to their parents? I mean, so
I
it's
know
hard to
mine don't.
get.
I don't even get a phone call.
So that's what lifts me up at home, just being around my wife and particularly my son. He's a joy.
They have this unique ability to just be able to enjoy life, don't
Yeah,
they?
yeah.
I was a young child who had a neighbor um, who had Down syndrome, and I was probably 8 or 9, maybe, and he was 40 with Down syndrome. And he would come over. His mother had him on a very strict schedule. And so he had a nap time and he had a time he had to walk his dog Sparky, but he would be our playmate. And he was big 40-year-old guy, but I mean, we played tag and King of the Hill, and we just loved him. He
Yeah,
was just so much joy all the time, you know?
yeah,
I think they bring a lot of a different perspective to life that we could all use every now and then,
right.
you know?
Yep, I totally agree with that.
Yeah. Well, that's awesome. Well, thank you again for all your sacrifice and all your hours of volunteers and all your positions of president and things to serve our community again. And we hope that you will train us well to eventually someday um, be able to take your lessons and show them and lead other sonographers to do
Yeah.
what you have taught us to do. So thank you so
Mhm.
much. I
Well,
appreciate
thank you, Debbie. You're already doing it. You're doing something that I could never do, but doing podcasts and
it.
promoting sonography. So thank you for everything that you're doing to make our profession better.
You're welcome. Thank you
Yeah,
so much.
thank you.
Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.